Achilles tendinitis. In this video, I'll tell you what it is, how do you treat it, and some exercises you can do to help with it. But let me start with the story of Ben. So Ben is a passionate runner with a few years of experience, and one day Ben started getting pain in the mid portion of his Achilles tendon. So Ben decided to rest from running to allow the symptoms to settle. And after 3 weeks of rest, the pain have settled and he's feeling good, so he decided to get back into running. But after Ben returned to running, 2 weeks later, the pain in his Achilles tendon came back. And that's when Ben decided to start working with me. He was frustrated that he listened to his body and waited patiently to allow his symptoms to settle, but it just came back again and it came back worse. And unfortunately, this is a pretty common story here with runners. And in this video, I'll tell you what's wrong with it, why just because you're feeling pain-free doesn't mean you're 100%, and what you should be doing instead so you can effectively manage an Achilles tendinitis. So Achilles tendon, it's actually the largest and the strongest tendon in your body. It starts from your calf muscle and it attaches onto your heel bone, the calcaneus. And its job is to transmit forces from your calf muscle into your foot and your ankle. And in the context of running, its biggest role is to help you push off with every step. Being the strongest tendon in your body, the Achilles can handle up to 12 times your body weight in running. And given the demands on the Achilles tendon, it's not uncommon for it to be a site of injury. Now, let's get back to Ben. When he returned to running after resting for 3 weeks, the first week of getting back, he was feeling good. He was feeling pumped that he's pain-free. He ran for about 8 kilometers in that week to take it easy. And because he's feeling pain-free and quite good, he amped up his mileage to about 30 kilometers in the following week, which is what he was doing before he started getting Achilles pain. And in that week, that's when the pain came back again in his Achilles. Now let's look at that a little bit more and talk about causes. We found that there were a couple of reasons for why Ben's Achilles tendon started hurting again after he returned to running. And the first one was that when he returned to running, he amped up his mileage too much and too quickly. Now you have to understand that training is great because the way we get stronger muscles and tendons is through exercise. And exercise is essentially a form of stress. And when you gradually increase the stress that you expose your muscles and tendons to, it sends a message to your brain saying, hey, this area is working really hard, so we need to get it stronger and more resilient in order for it to cope with the stress that we're demanding of it. So as a result, your muscles and tendons start to remodel and adapt, and it becomes stronger and better conditioned for the tasks that we demand of it. But simply speaking, when Ben did too much too quickly, the load that he's demanding of his body is increasing faster than his body's ability to adapt and cope with that load. And when this happens, your body is really just trying to play catch up. And that's why one of the earliest signs of overtraining is pain. It's just your body's alarm system alerting you that, hey, maybe you're doing a bit too much and you need to take a step back and look at what's happening. And this repetitive overloading process is one part of the pathway that leads to what we call tendinitis, or more accurately, tendinopathy. And this is really where you start to feel your tendon becoming painful and tender and sensitive. Now, when I explained this to Ben, he was a little bit confused because he was running 30 kilometers a week before his Achilles started bothering him. And to that I said, he's right, but because he's had 3 weeks where he wasn't doing any running, it's likely that his calves and his muscle would have deconditioned. They would have gone a little bit weaker. So therefore, they would have been a little bit less acclimatized to that 30-kilometer load that he was doing before. So I said, because your calves and your Achilles have deconditioned over the last 3 weeks, and then you've spiked up your running quite quickly, you've just overloaded it even though you're doing what you were doing before, because overloading is always relative to your current capacity. And Ben's current capacity had likely reduced to a stage where running 30 kilometers per week was probably a bit too much for him straight away, especially if he hadn't given himself enough time to gradually build up back to it. If you're a runner, how do I know what's too much too quickly? And unfortunately, that's a little bit hard to answer without context, because what's too much would depend on the individual. It depends on your level of conditioning, what your baseline is, how much you're running, how much you're training, your history of injuries, your current injuries, how well you're recovering, how well you're eating, how well you're sleeping, and what your goals are. And even things like how stressed you are and how you're moving your body during the day. So many different things, right? But in the case of Ben, even though he was a decent runner to begin with, having rested for 3 weeks from running because of an Achilles tendon pain, and then suddenly spiking up to 30 kilometers per week mileage, which is probably the maximum of what he was doing before, for him that was probably a bit too much, because that's when he started getting pain again. And I will argue probably for a lot of runners, going from 0 to 30 within 2 weeks, when 30 was kind of the maximum you were doing, is probably a bit too much, but then again, it will depend on you. Had Ben maybe given himself perhaps 4 weeks to build back up to 30 kilometers of weekly mileage, possibly he would have been better off. But look, I'll say this again, all of this would depend on your individual case, because even though 2 people can have the same injury, the recovery and what it takes to get there can look very different. And now this leads me to the second mistake Ben made, and that when his Achilles started hurting, the first thing and the only thing he did was to stop running completely. For most tendinopathies, we do need to let things calm down initially, but for most cases, I don't recommend complete rest as our first option. And that's because when you rest, you decondition, and we want to minimize that as much as you can and the negative things that come with it. When you decondition, your muscles get weaker and it's harder for you to then build back up to your normal training volume, and it's something that we want to avoid if possible. For the most part, tendons like a consistent load, so suddenly doing nothing and then suddenly doing a lot of things will often irritate your tendon. And yes, there are cases of aggressive tendinitis where we may benefit from a complete rest, but it's always just temporary, and we want to encourage other forms of activities, and the plan is to gradually build you back up as soon as we can. And look, I think that works well for most runners, right? Because most runners probably don't want to stop running. So if you're dealing with some form of tendinopathy and a health professional that you're seeing is telling you to completely stop until all pain settles, make sure there's a good reason for it. So in Ben's case, what I recommended was, instead of stopping running completely, how about we try to change a few things to see if you can still run but not let the pain bother you so much. And what to change and to what extent will depend on you, but usually the process involves the physio and the patient testing a few things and working it out together. And in the case of an Achilles tendinopathy, we might try to cut the speed work because faster paces can be more irritable for the tendon. We might reduce the uphill running because then that puts more forces through your Achilles. We might cut the distances a bit shorter. You could also try wearing a more supportive shoe with a high heel to toe drop because that places less stretch on your Achilles. Not saying go buy new shoes because that takes time for your body to adjust, but just see what you already have in your rotation. The point is, there's usually a few things that we can change and modify in order to get that symptom reduction without needing to stop you from running completely. Sometimes things like foam rolling and massage can help with pain relief, and they can be helpful in the early stages, but just know that the job is purely symptom reduction. And symptom reduction is great because obviously it feels better, but it can also make you move a bit better. But the important things to know is that things that reduce your symptoms don't directly speed up your healing or break down your tissues. It doesn't work like that. They really just help to desensitize the area to help you feel less pain. And that's helpful if it means you can go through your rehab a bit better. And the last point, Ben, like a lot of runners, was doing a lot of calf stretching. He was doing even more calf stretching when he was getting the Achilles pain. So when I was working with Ben, I said to him, instead of stretching, how about we just not do it for now? And especially in the case of Ben, the problem for him wasn't necessarily a lack of calf muscle flexibility. Instead, he needed to build strength and endurance in his calf muscles, so we need to load it up heavy instead. Sometimes with Achilles tendinopathy, doing a lot of calf stretching can actually make it worse, especially if it's more of an insertional type of tendinopathy, because that puts a lot of end range compressive force on the tendon. So for Ben, I told him, how about we just pause on the long passive stretches for now, and we'll focus on the strengthening instead, because I think that's more important. And later on, once we progress to doing rehab exercises such as the deficit calf raise, he's actually getting a nice stretch in his calf under load, and actually that's probably even more effective in improving his flexibility in the long run. And I'll cover that in a second. All right, so a bit of a recap. Mistake number 1, Ben did too much too quickly when he returned to running. Mistake number 2, all he did in response to his pain initially was a complete period of rest. And number 3, he was just doing passive stretching without any structured rehab. So how do we actually fix Ben? Here is the plan of action. Firstly, because Ben came to me already in pain, so we need to find a couple of things that we can modify so that we can cut the pain down but keep up as much running as we can. And after a bit of testing, we worked it out for Ben that was cutting out the speed work, reducing the heel work that he was doing, and also just cutting his distances to a couple of shorter, easier runs throughout the week. That way, he was still able to do some running, probably about 15 kilometers of total mileage per week, without the pain bothering him too much. And of course, we implemented a plan and a time frame that gradually increases his mileage, accounting for how his pain behaves. Secondly, at the same time, we need some progressive and tailored rehab exercises to strengthen and load up the Achilles tendon. Typically for a lot of injuries, we don't need to go super specific with certain exercises, but in the case of an Achilles tendon, one exercise that we did focus on for a large portion of his rehab was a simple calf raise. This is probably one of the easiest and the most effective ways to load up your calf muscle and your Achilles tendon, and there's a couple of ways we can modify the calf raise to suit your current capacity. So, how do we actually fix Ben? I'll get into that. Let's head to the gym. All right, now we're at the gym. So remember how I said rest, especially by itself, is not a good treatment option for Achilles tendinopathy. And as a matter of fact, it's not good for any sort of tendinopathy. Because when you rest, you don't increase the tendon's ability to increase its load tolerance and its resilience. And that's actually what we need to do to get it better and to get it to heal. So as we calm things down, we also want to build up the strength and the resilience and the capacity of your Achilles tendon. And the only way to do this is through progressive strengthening exercises. So we'll go over some of the things I do with someone like Ben. We got Catherine here to help us out. Let's get it done. Okay, so first and foremost, for those of you that are in a level of pain at the moment, a really good exercise to start off with is an isometric calf raise. So we'll get Catherine to demonstrate that. You ready? We're gonna hold on to something for support. And then what you're gonna do, Catherine, is you're gonna rise up onto your tippy toes and you wanna go as high as you can. An isometric calf raise means we're just gonna hold that position for about 30 to 45 seconds and we're not gonna come up and down, okay? How's that feel?
Yeah, good.
Good.
Yeah.
This is a really good exercise to help reduce that bit of sensitivity in your tendon and to gently expose your tendon to a little bit of load. Let's look at that one more time here. It's from the back, okay? Hold on to it, come up tall, good. Hold that for 30 to 45 seconds, and then you slowly come back down, okay? So you can do this for about 3 to 5 sets with about 1 minute break in between. With this exercise, it's okay to get a little bit of pain as you're doing it. I say no more than 3 out of 10. But what we sometimes expect to see is that pain slowly start to creep down as you expose yourself more and more to this load. Okay, so the second exercise we can do is just a normal calf raise. So what that looks like, Catherine, is you're just gonna come up nice and slow onto your tippy toe and come down. Let's try that again. That's why we hold on, okay? Yeah. So come up nice and slow, good, and come down. Just a normal up and down calf raise. We're working the concentric and the eccentric portion of the movements. Cool. So what we want to see is we want even pressure throughout the front of your foot as you do this. Hold on, and then we'll try that again, okay? Yeah. I always encourage someone to hold on because of this reason, all right?
I'm trying to impress everyone.
Try that again. Yep, come up onto your tippy toes, good. Even pressure through the front of your feet, and then you're gonna slowly come down, okay? So what we also wanna watch out for is we don't want your feet to roll out and sickle like this. We wanna keep your foot going up in a straight line. What we also don't wanna see is a sudden drop or loss of control on the way down, okay? The way down is just as important as the way up, so you really wanna control the second half of the movement as well. One thing you can do is count 3 seconds, so 1, 2, 3, up, hold for 1 second, and then you go 3, 2, 1, come down. Perfect. All right, so the third version we want to do now is a single leg calf raise. It's getting good. So Catherine, why don't we have a look at your single leg calf raise? So as the name suggests, you're just doing a calf raise, but on one leg. So obviously this is a lot harder because you have to lift up your body weight with just one foot. How's that feeling?
Hard.
Calves are burning. Good.
You don't know how many calf raises I've done for this video.
Not that many.
Okay. So many.
So pretty much same concept. We want to come up in a straight line. We want even pressure through the front of your foot. We want control up and control down as well, okay? When we're at this stage of the rehab, I expect you to be able to do this quite comfortably. I expect you to do this pain-free. So it's definitely something we incorporate a little bit later down. Most of the time, it's not straight away because it's just a bit too much load to begin with, especially if you are getting a bit of pain. And now we're also at a stage where we can start to mix things up. So for example, an easy way to progress the single leg calf raise if it's not hard enough, and for a lot of people, I want them to actually get to this stage, is actually adding a weight.
Oh, yeah, this is
So we've got the gentle, friendly 8 kilos. Oh. Okay, same thing. All right, well now we're just holding an extra 8 kilos, that's all.
It's nothing. It's like a feather. Oh. I'm gonna be so sore.
Good, that's it, perfect. Okay, I'm gonna do some of the other ones now, okay? We're gonna take turns. Another thing we can add in is a step. A step is good because you're able to drop your heel past the edge of a step to get a bigger stretch on your Achilles tendon. So what we can do for this one is you can go back to your double leg, you can come up, but this time you're just gonna come all the way down, let your heel drop past this edge of a step, feeling that stretch in your Achilles tendon, and then likewise control the way back up again, all right? So going down, descend past the step, stretch, come up. This is really good to get that extra bit of range of motion in your calf. One thing you do want to watch out for is, especially if you're getting Achilles tendon pain right at the insertion, this can just be a little bit too irritable, so you want to watch out for that. But for example, someone like Ben, they're getting pain in that mid portion of the Achilles, this might be more tolerable. But the insertional, we just want to be a little bit more careful with that. And of course, what we can do with this one, you're gonna go single leg as well. Same idea, up, down, past the step, yeah? Up. Once we're comfortable with that, adding a weight, come up, come down. Same thing, up, down. For those of you that find that double leg is quite easy, but single leg is a little bit too challenging, there's a couple of things we can do to kind of segue that transition. So, the first thing you can do is come up on 2 legs, shift onto your effector side, stand on that one leg, and then you come down. Good, so you come up on 2, go onto 1, come down on 1. That way you're just working on the eccentric or the lowering portion of that exercise. Another way you can transition into being able to do single leg is do a front foot elevated calf raise. We'll get Catherine to demonstrate that. Bring one foot onto the bench, okay? So this is just gonna act as a little bit of a support. The working leg is the one behind, okay? And then same idea, come up using the back leg, good, come down. And you feel that actually takes a bit of pressure off, right? The back foot,
yeah.
Cool.
Bit easier.
Bit easier than just doing a pure single leg, and definitely harder than a double leg. So kind of that sweet spot in the middle, right? How's that feeling?
Yeah, that's good. Well, you can do it differently as well, because you can do it behind as well. Good. Woo. If I don't fall over.
Yeah. Kind of cheating a little bit because Catherine's also a physio.
Shh, they don't know that.
Now, running is a dynamic exercise that involves high forces. So ideally, we want the rehab to mimic the forces that you're going to receive when you're running. So a way to do that is through plyometric exercises. And a really good one to begin with for your Achilles tendon is called the pogos. So Catherine, we practiced that before. I think you're going to get it now. A pogos, essentially, you just want to be jumping, but instead of doing a squat to jump, you want to bias the movement at your ankle. So go for it. Nice, nice, good. A little bit less knees. Yeah, that's it, good. And pause, cool. And this is really good because we're forcing your Achilles to absorb the impact and then quickly release it, all right? So this really mimics that impact you're getting when you're running. And running essentially, like I said, is a series of single leg hops. So this is the sort of stuff that we want to be doing at later stage of your rehab. How did that feel?
Hard, because I've done a lot of calf raises already.
So pretty much you want to stay a bit relaxed at your ankle. You want that springiness and that recoil action happening at your feet. You don't want to just do a squat jump, which is a great exercise, but for your Achilles tendon, if you want to bias that in the plyometric exercise, you want to do this instead, okay? This instead of, right? See the difference? Likewise with the calf raise, for this sort of plyometric exercise, we can progress onto single leg as well. So that would just look like more of a hop. So it's gonna be like this. And again, we're putting a lot of load through your Achilles tendon by jumping on one foot. We're getting it to stretch and contract really quickly to absorb the force and quickly release it. So for these ones, often I can get people to start maybe bouts of 10 seconds, 20 seconds, maybe 30 seconds, and have a little bit of a longer rest in between, maybe at least 30 seconds to a minute. All right, these are some great exercises to address the Achilles itself, but with any sort of injuries, it's important that we look at the whole body as a kinetic chain, because every part of your body is all connected with each other. So for example, with an Achilles injury, we'll want to be looking at things like your posterior chain, so like your hamstring strength, your glute strength. We want to look at your body holistically to see if there's any factors that's contributing to your Achilles being overloaded, and we want to address that in our rehab as well. Now, very importantly, we need to select the right exercises for your particular injury, but what's also important is to do it at the right intensity and the right dosage. So it's great that physios can give out top 3 exercises for an Achilles injury, but how many reps? How should it feel? How often? How can you modify if it's too hard? How can you do it differently depending on what you've done during that day? These are some of the factors that we need to get right in order for you to have success in your rehab, because injuries are complex and every injury is different. And at the end of the day, everything needs to be goal-driven. So what do you want to get back to? Where do you want to be? This should be the ultimate aim of our rehab, and everything we do should lead you towards that goal. So remember that, people, if physios can just dish out cookie cutter exercises for every single injury, then I wouldn't need to assess anybody. I wouldn't need to communicate with people, and I won't need to adjust the plan and change things according to how it's going. It just doesn't work like that. It's like you're trying to throw a pass on a wall and trying to see what sticks. Injuries are complex and individualized, so your rehab should be tailored and specific for your case. So with that out of the way, in summary, to manage an Achilles tendinopathy, the first thing we need to do is let things calm down. At the same time, we want to try to load it up as much as we can and get it to be stronger, get it to be more resilient, and get it to cope with the load that you demand of it. What I'll also say to someone like Ben is that tendon healing actually takes a bit of time, because unlike a muscle where it has very rich blood supply, tendons don't have that very rich blood supply. So healing can take anywhere from 8 to 12 weeks at least. And part of that healing involves you getting stronger as well. And if you've done any sort of strength training at the gym or outside the gym, you would know that getting stronger can take a bit of time as well. And of course, when everything was done right, Ben was able to get better and get back to running. There were a little bit ups and downs in the journey. Of course, that's with everyone. But in the end, he was able to build up his mileage safely. He was able to complete a half marathon later in the year, and just happy days. That's it, folks. I hope you guys found this video helpful. If you're a runner out there dealing with some form of Achilles tendinopathy, I hope you learned something away from this video. I hope it showed you what a good quality rehab process looks like. What are the sort of things you need to do in the gym, out the gym, to manage this injury effectively, and what it kind of takes for you to get to 100%, to get to where you want to be. I also hope you took some things away to help implement into your routine to help you reduce the risk of that injury from happening. As always, if you guys have any questions, drop it in the comment below or reach out to me directly via Instagram. I post content on there about injury prevention, performance optimization in terms of running and fitness, so check that out. And if you guys haven't already, smash the like button, subscribe to the channel. It helps out more than you know, so we can get this message out to more runners to look after the Achilles, to look after the injuries, and to make the running journey as enjoyable as they can. I'll catch you guys all in the next one. Peace.